Degenerative disc disease is kind of just the spine wearing out. We all wear out as we age, and the discs are no different in your neck. They wear out the same as any other part of your body, and that's what degenerative disc disease is disc wearing out in your neck. Usually before we talk about something like a neck surgery, I usually recommend to my patients that they try something like physical therapy. They can try various injection options. Sometimes if there's severe spinal cord pinching, truly surgery is the recommended treatment, but that's not very typical. Usually we recommend other conservative cares first. Disc replacement surgery is actually going through the front of the neck, taking the disc out, and then replacing it with an artificial disc. And typically that is done in order to take pressure off the spinal cord and nerves. An ACDF is an anterior cervical decompression and instrumented fusion. And what that essentially is going in through the front of the neck, taking that disc out, and then putting a little shim in with some cadaver bone, and then usually a plate and screws over the front to hold everything still. If we're trying to determine between something like a fusion and a disc replacement, a lot of it has to do with age, how worn out the discs are. If there's any instability in the neck, usually a patient can't have a disc replacement. And sometimes if the discs are so collapsed, they can't have a disc replacement at that time. Usually the disc replacement surgery is a little bit faster recovery, usually by about a month, month and a half, because we don't have to limit the activity restrictions as long with the disc replacement surgery as we do with the fusion. Obviously with the surgeon you want to make sure that they've had good outcomes in the past and it's something that they've performed a lot of in the past. You also want to make sure that you feel like you get along with your surgeon, that you trust that surgeon's judgment.